Good. Well, good morning. This is Tim Damon with the Lansing Regional Chamber. We're going to get the program started here shortly. We'll allow everyone a few minutes to log on and get ready. So hang tight and we'll be right back with you. Well, good morning, and I want to thank everyone for joining us for today's program. A little bit of a local perspective on COVID-19, and we're pleased to be joined this morning by Dr. Peter Graham, Chief Medical Officer with Physicians Health Plan, and Greg Brogan, who's also a managing partner with Brogan, VanGorder and Associates. We'll also be joined for our question and answer session at the end of the presentations with Sparrow Chief Medical Officer, Dr. Karen Kent. Morning's topic here and talking a little bit about the what does it look like here in mid-Michigan for us, what our insurance carriers are doing, what does it look like for benefit delivery, premiums, as well as other support opportunities for businesses and employers. What does it look like for continuing insurance coverage for furloughed employees or employees that have been placed on layoff, and mental well-being of all of our people, and many other topics as well this morning. So just a few items before we begin. Probably like everyone, as we grow a little bit more familiar with these Zoom webinars, we have put everyone on audio. We've muted everyone's audio this morning, and we'll utilize the Q&A mechanism at the bottom of your screen to ask questions at the end of the presentation. But feel free to submit those questions at any time during Greg or Dr. Graham's presentation this morning. We will get to as many of those questions as we can by the end of the program. We're going to begin this morning with Dr. Graham from Physicians Health Plan, and then we'll go into Greg's presentation, and we'll leave 20 to 30 minutes at the end for Q&A. And so I'm going to, at this time, turn it over to Dr. Graham to begin our program this morning.
Thanks, Tim. I appreciate it. And go ahead and tee this up. Thank you. Okay, just a little bit of orientation of what I'm going to be talking about through the next 6 or so slides. COVID is a very broad topic, so this is by no means an exhaustive discussion of COVID. You'll probably be happy to know it is not going to be a lecture on virology. It's really going to be trying to talk about this from the perspective of health plans, for you all as employers, understanding what this means in terms of your own associates and how you navigate through this. So give a brief overview of that, talk a little bit about some of the clinical detail about COVID just to help orient to where the benefit discussions go, and then a little bit about kind of what the future might look like, because I know that's a little bit of a concern for a lot of employers as well. This is probably a familiar screen to most of you who are either looking at this or the Johns Hopkins site. I know a lot of folks have been tuning into that one daily. The take home on this, and not to belabor a lot of time on this is what we'd refer to as a pandemic. from the Greek pan, meaning all, and demos, people. It basically means everyone is potentially at risk. Although this is a fairly New York City and tri-states area heavy map, I think as you look through this, what you'll begin to see, and you can start to see it in kind of the ink blot distribution, there's not likely to be a corner of the United States that is not affected by the end of this. And in point of fact, this is the first natural disaster in history where the entire United States has been declared a disaster area. So the take home from this is that this is a pandemic that is spreading throughout the entire United States. Currently, actually, we're up to about 560,000 cases as of this morning that are laboratory confirmed. Unfortunately, about 22,000 fatalities nationwide that have been attributed to COVID. If we go to the next slide, please. For the state of Michigan, sort of a reprise of what we're seeing with the national map, and kind of two caution notes on this. At the moment, this is predominantly a Metro Detroit heavy phenomenon. Most of the cases in the state of Michigan, we're up to about 24,000 cases currently, and unfortunately about 1,500 fatalities. The vast majority of those, both cases and fatalities, are in the Metro Detroit area, predominantly Wayne County. The caution note I'd add to this is what we don't know is how far this continues to spread and what this continues to look like. We've seen some encouraging epidemiologic news in the last couple of days. It does not mean by any means this is over or definitive. Also tells us that pretty much every county in Michigan will see at least a few cases. So just give you a little sense of perspective of what this looks like in the state of Michigan. If we could go to the next slide. So what is this thing? And I know we get a lot of questions about this, both from members and occasionally from employer groups, trying to kind of get their head and hands around what do we need to know about this. The first bullet, and what I take pains on, this is kind of an odd duality about what we've seen from COVID-19 so far. The good news, and worth underlining, about 95 to 98% of people who get this are going to survive. However, pivoting that around, it means about 2 to 4 to 5%, depending on whose math you use, are not. That is a pretty high number. You know, the good news, again, that there's that 95, 98% survival rate, but for most of us, we have not lived with that kind of risk from infectious disease in our lifetimes. Our foremothers, forefathers probably would have shrugged at that, but for us in the post-vaccine era, this is not something we're really used to. You know, by contrast, most of the infectious diseases that we've lived our lives with have maybe a 1 in 50,000 to 1 in 100,000 case fatality rate. So this is kind of new to us, as the name novel coronavirus would imply. The other take home is that about 80 to 85% of people that have this will recover on their own with no particular medical intervention needed other than awareness and a little bit of counseling and coaching. So about 80 to 85% of people who have COVID treat it like a bad upper respiratory infection or influenza, take medications to deal with the symptoms and rest at home and hydrate and all that good stuff. About 15 to 20% will need to be hospitalized. And of that 15 to 20%, a fairly small percentage will actually need to be ventilated. I know we spent a lot of time focusing on ventilator capacity. I think that might have left the impression that everybody with COVID is going to need a ventilator. That is by no means the case. It is a significant portion of folks, but just to kind of frame up that this is something to be respected but not panicked over, I think that's probably the best way to look at it. Just a couple things to help guide you all is understanding what happens, particularly if you're a essential industry or one that is still open, still have people working on site. What do I do with folks if they have this, or what are the recommendations? I'm skipping or foreshadowing a slide ahead. Best guidance on this is they should be working with their own primary care physicians. I'll get to that in a second, but for your understanding, I really recommend people minimum of 7 days after onset of symptoms, they should be out of circulation. That's basically at home, minimum contact with other people in their house, good hand washing, good hygiene, good contact avoidance. At the end of that, if they've gone 7 days without fever, or gone 3 days, excuse me, without fever or other symptoms, and it's been greater than 7 days, they're generally considering this is based on CDC guidance, able to be back out in circulation with other people. I would consider this as also a helpful guideline for folks who are working remotely. I know there's a temptation to think, well, they're remote, they can continue to work. There's a variable impact of this illness, but for some folks, it is like a punch in the nose. And I would really give them the time to convalesce and not be trying to work and not be trying to be doing the daily grind while they have this. They're going to be potentially really sick and they're not going to feel very good. So make sure you have that in mind, that's about how long it takes. The symptoms I'm not going to belabor. I think you know most of them. The hallmark of this really is fever and cough. And the unexplained loss of taste and smell, it's another one just to be aware of. I know I get this question a lot. How do we know it's this and not the flu or not the common cold or other things? Those are the things I'd really look for. And those are the keys to be talking to your own physician. Risk factors. By risk factors, I don't mean risk factors for contracting the illness. There are a few, but I would assume that all of us are at risk to potentially be infected. This is risk factors for worse outcomes, and really a couple things that play into that. By exposure to confirmed COVID, that's really predominantly healthcare workers or first responders or people who are working with the public. So, you know, grocery store employees or truck drivers, delivery folks. Age, although I would take pains, and this is a duality one as well. Unfortunately, it leaked out or got into the common media very early that somehow younger people were immune to this. That is not true, and some very young people are getting very sick and unfortunately dying of this. However, if you look at it on a population basis, it is really risky for the elderly, so folks over 60, 65, and accelerating upward by the time people get in their 80s, 90s. Other health conditions, particularly diabetes, hypertension, obesity, existing lung disease like asthma or emphysema or heart disease really put people at risk for worse outcomes with this. Folks are immunocompromised, so if you have any staff work for you who have recently been treated for cancers, have had organ transplantation, HIV, or take some medications for other things. One thing I would add to this, and you know, if you harken back to the very first map we've shown, we're seeing that this has a disproportionate impact on African American and Latino communities for a variety of reasons. So I would add that in as a risk factor for worse outcomes. When do people need to consider hospitalization or emergency department visits? Again, this is, you certainly don't want you all as employers having to behave as healthcare providers, but again, just for understanding, the determinants for that are usually shortness of breath, chest pain, and confusion. I would add to that, unfortunately, I just dropped off my edit on this, bluish tinge around the lips or nail beds. That's a sign that folks really need to seek more intensive care. We could go to the next slide, please. So what do we do with this? And I've had this question come up in several contexts, and I want to really talk about two parts of it. Who should be kind of managing, coaching this, and where can folks go for testing? Because that's come up as a question quite a bit. A little bit of a plug, and I will fully confess I'm a flag flying, card carrying primary care physician. So this is maybe slightly biased, but based on you know, both the logic of the epidemic and what we know. Important principle overlying all of this is trying to avoid contact as much as possible, and this includes with the healthcare system. I know we're typically accustomed to trying to get people physically into spaces where they're healthcare providers. In this particular instance, you really want people to be avoiding that as much as possible. However, primary care physicians are their best point of contact, and this is a really great time to have a primary care physician. They know you, they know your history, they know what your risk factors look like, they have some rapport with you. That's a great place for people to start. And if they are concerned, have symptoms, if they're worried, the first place they should be going is to their primary care doctor. Now, by going to what we mean, and Greg's going to talk about this a little bit, and I don't want to steal his thunder too much, telemedicine has really kind of had its moment. Most primary care docs, and a shout out to my primary care colleagues, nationwide, but also locally, have adapted very rapidly to be able to provide a lot of the services they typically provided remotely. The government has also done a very good job. CMS has relaxed a lot of the restrictions that used to exist around use of technology for this. Most people can contact their primary care physician, get most of their questions answered, get problems dealt with either telephonically or using things like Skype or FaceTime or Hangouts or other face-to-face technology. Telemedicine. So telemedicine is available first and foremost if you have a primary doc and have an established relationship. That's where I would go first. And if you're getting questions from your rank and file, that's where I would point them, or in your own lives. Telemedicine is extremely helpful for folks who don't have an existing relationship with a primary care doc. This would be a really tough time to try to get that set up for a variety of reasons. If you don't have one, two resources I'd really point people to. One, Sparrow has put together a superb web page on COVID. You can find it at sparrow.org. It's one of the top banners there. It's really easy to locate. Has links to a lot of really helpful information, a lot of it patient facing, very easy to use. And I would strongly encourage people to use it as a resource. It also provides essentially a front door to American Well or Amwell, which is sort of the Coca-Cola to Teladocs, Pepsi in the telehealth world. They're the two largest telehealth providers. American Well, who is the provider of record for the Sparrow link, and this is also provided, by the way, without cost if it's a COVID-related encounter for the Sparrow site. American Well is a PHP provider. They're in our network for almost all of our plans. It is an included benefit, and we have offered that without cost share during the COVID epidemic or pandemic. Just for your edification, because I know this comes up quite a bit, the Amwell folks are board certified licensed physicians, MD-DOs. Understandably is not the same as a face-to-face encounter, obviously, but a lot of what typically gets encountered in an office can be handled through telehealth. So a really good time to take advantage of that option. Testing, and what I'll kind of, if you don't take anything else away from this one, I think the most important thing to remember, because what I've heard from a variety of quadrants is, I can't get folks in for testing. They can't reach it. How do we get folks to testing? What I take pains to message or enforce or focus on, most people do not need testing. And it's a little bit confusing, I think, after we sent out a lot of messages about it, at least in the moment. Testing is really reserved for a few, it's a limited resource. I think it's the best way to understand it in the moment. And it's limited to a few circumstances where it's really going to change the outcome or change the way we manage somebody's care. And for most people, if you go back to that 80–85% are going to recover uneventfully, you treat it as if they have COVID, and it really doesn't matter whether you've done the test, yes, no. There are some specific circumstances where you need to know that. It's based on other contacts they're likely to come, other people they're likely to come in contact with, particularly if they are an essential worker. They're going to be in contact with the public. If they're a healthcare worker, it's a very different set of calculi. And that being said, it's also subject to physician discretion. If they see a good reason they need to know that it's going to change their care, they will need to do that. So the other take home is testing is only available with a physician order. So please understand, people can't just kind of drive up to one of the drive-through sites and say, I'm just kind of worried, or I just want to know. We are not able to do that yet. No one is really doing that in any municipality that I'm aware of. I will not go through the sites there. We will be providing this later, but just to let you know, there are several places where this is available. If people do have a physician order, it's very easy to get this done. Sparrow has done a great job of getting this available broadly throughout the community very rapidly. If you're really at a loss, sparrow.org/lab has a listing of all those sites and can be reached relatively easily. We can go to the next slide, please. So what does this mean for you as a business? And the top two bullets I'm just going to hit very quickly, and the last two I think we really need to spend a little bit more time on. The top two you guys are already doing. How do we keep people distanced and safe? I know a lot of you have moved to working from home, done screening of both employees and customers, and customers/clients, using masks appropriately, 6-foot halo, and doing things through e-commerce. Quarantine, we already talked about a little bit. That's an important part. I'd think about preparing to reopen, and if there's a message about the future here, about what this is likely to continue to spin out to be. I would start thinking about what life looks like. It's going to hit us quicker than we think. I think hoping that this all goes away in a relatively short time frame is probably not a wise strategy. I'm based on the science and the epidemiology. We're going to be living with COVID for a while until there is widely available testing and ability to contact trace, and until there is a safe and effective and widely available vaccine. It is going to exist. It's going to be something we're going to have to accommodate to. So as you think about opening up back to kind of more public facing business, be thinking about what are the things I would need to do to continue some of the social distancing or physical distancing things that we had in place. And it's everything from as simple as, do we keep, what happens with the good old fashioned handshake? That may just not be the wisest thing to be doing for the next couple of years. Are we going to maintain counters and do things that we typically did, or are we going to figure out different ways to run our businesses? The last bullet is a really important one, and I am stealing shamelessly from my longtime friend, I won't say old friend, Greg, who's going to be talking in a minute. This is really a three-part epidemic, or a three-part event. And one part is the virology and clinical that we've talked about and are spending a lot of time and focus on. The second is the economic one, which is by no means less important, and we're all seeing and feeling that. The third, and this one is kind of an iceberg under the surface, there is an awful lot of trauma associated with the psychological trauma. And I think, we're in the acute phase of this. We're all kind of running on adrenaline. We're getting through it. But if you think about everything from uprooted daily routines and losing jobs and worrying about family members and people being ill, losing friends that we can't go to funerals or memorial services for, or people dying alone, or seeing things that are really stressful. I know it sounds like overstatement, but that is a recipe for an awful lot of stress and an awful lot of PTSD, which sounds a little dramatic, but it's really not. And having fear for your own safety and fearing for the safety of others and seeing things that are unpleasant happening to people is a really, really stressful thing. Where I'm stealing from Greg is, this is a great moment to understand, if you have an employee assistance program, dust off the terms of use and get this one deployed. A lot of you have this through, and again, Greg's going to talk about this in more detail, or can answer questions on it. Good time to dust off what are the terms of service, how is it available, and do it sooner rather than later. If there's one thing that's relatively clear from the literature on this, when people experience a trauma like this, the sooner they get help, the better they do. And even if you don't care about it from a humanitarian point of view, the faster they're going to be back to work, and the faster they're going to be more productive and able to do what they normally do. And a lot of folks are very reluctant to take advantage of this unless they kind of feel like somebody is supporting them in doing that. The other point in this one, this is also a good time to look at telehealth. I know we typically think of telehealth as kind of a electronic urgent care. Counseling services are available through most telehealth providers, including, and we'll talk about this in just a second with our benefit structure, including our in-network psychologists and counselors. If you think about it, counseling and those kinds of services are really well suited to telehealth. It's mostly about conversation. You really don't have to be in a physical space to do that. You don't have to be laying hands on people to make that happen. So really make sure your folks understand that that's available to them, and don't be afraid to use it. This is a really, really good time to have that available and get on top of it. We go to the next slide, please. Last slide for me, and a couple things I'll hit on. PHP has really tried to respond. We've tried to be ahead and be a pace setter on this. In some areas, I think we have kind of led the industry in Michigan. In two really major areas of focus, and one I hope you're seeing, feeling, and ones I think you should be looking for from your health plans. One is removing barriers to care and expanding access, and a couple of things that we've done, and a lot of other plans have followed suit, are removing the member cost share for telehealth, expanding access and pharmacy access. That is now part of the governor's enhanced shelter-in-place order. We were ahead of that several weeks ago. On the other side, and this is really more, and Greg will get into more detail about the premiums and eligibility requirements and enrollment. The removing red tape one, we've really streamlined or lightened up on the provider side, making sure we're working collaboratively with them. The last thing on earth they need to be doing is jumping through a bunch of utilization management hoops, trying to get patients from A to B. I want you to be assured that if you're a PHP subscribers, we're working very closely with our care providers all across the network, trying to make sure folks get to the care they need. Not just COVID, by the way, because remember, people are still getting sick with other things or still need other kinds of health care. That does not go away in the moment, so continue to work on that as best we can. Thanks, that's what I had. So I will hand it over to Greg.
Greg, are you there?
He's on mute.
Unmute. Okay.
There we go.
Got it.
My
Sorry about that,
apologies.
folks. Thank you for the chamber putting this this webinar together. Thank you, Dr. Kent and Dr. Graham, for your participation in the COVID webinar. I am happy to say that the insurance industry has really stepped up and supported small business throughout this this pandemic. We've received a lot of questions about who can stay on the plan. Tim, you can slide to my next slide. Thanks. Interestingly, typically when an employer lays off an employee or furloughs an employee, they're required to be removed from the plan. But the insurance industry, PHP, Blue Cross, McLaren Health Plan, Priority Health have all agreed that if you want to keep your employees on your benefit plan, you are able to do so even if they are removed from your payroll and collecting unemployment benefits. So that brings up the next question about, well, how do we pay for those premiums? The employer can pay 100% of the premium and look to get reimbursed for those dollars from a future payroll protection loan that would be forgiven if you use 75% of that loan for payroll and benefits. Or you can continue your premium sharing that you have done in the past with your employees. You can defer those employee payments until the employee comes back. You may want to have something in writing with the employee about that and keep a signed copy in their payroll file, just so they know that they may be coming back to some premium sharing once they return to work. But employees can stay on the plan as long as premiums continue to be paid. Next slide, Tim. This brings up another point that I think the insurance industry has really helped out with, and that is extending the grace periods for when premiums are due. So many of you have premiums coming due in May or for the 1st of May in late April. And you may not have your payroll protection loan proceeds in yet to pay those premiums. All the carriers have extended their grace periods. PHP, showing some leadership, jumped in early and extended their grace period to a 90-day grace period. Blue Cross has a 30-day grace period, which is their traditional grace period, but they are willing to work with groups on a case-per-case basis. So if you have Blue Cross and Blue Shield, they do have a COVID hotline that you can call or you can email, and they will work with you on extending the grace period. McLaren Health Plan has extended theirs to a 45-day. Priority Health is similar to Blue Cross. They've maintained their 30-day grace period, but also looking to extend that to 60 days. It's my understanding this week that they're likely going to move that to a 60-day grace period. Delta Dental has put in a 60-day grace period, and many of the other ancillary carriers for dental, vision, life, and disability coverages have extended their grace periods out 60 days. So the message here is that if you have premiums due coming in on May 1st, you very well may want to use that grace period, extended grace period, and delay paying those premiums rather than removing your employees from your benefit packages. Not only do you have the workload of taking them off and then trying to get them back on, but also remember that your PPP loan is only forgiven if you use 75% of it for payroll and benefits. You want to slide to my next slide? So that's what this slide is addressing. Remember that the PPP loan is for employers with 500 or less employees. I did see some funding coming in last week for some larger employers. I know the hospital's been asking for additional bailout funding, and large employers also, we're starting to see some of that come through. I think there's another piece of legislation planned for later this week for the larger employers. But the PPP loans, very popular. Just about every small business will qualify for these loans. And they even moved into offering them to contract workers, 1099 folks, and sole proprietors as of last Thursday. The loans are forgivable as long as you use 75% of the loan proceeds for payroll and benefits. The key there is to make sure that if you've laid off your employees, that you're willing and able to bring them back. Not every business is necessarily going to be able to do that. But if you bring them back on payroll, you can choose the 8-week portion between February 15th and June 30th in order to qualify for the forgiveness of those loans. I would encourage you to seek guidance from your CPA and your attorney. And my banker was really good about working with me on identifying what was needed for qualifying for these loans and substantiating my business expenses. So I encourage you all to reach out to your counsel for help with this. Next slide, Tim. So the other area that the insurance industry, I feel, is really stepping up is that the waiver of all the treatment and testing costs for COVID have been waived. For all the major carriers in Michigan, this is true. This is for fully insured plans. If you are self-funded, you do have the option of including the treatment of COVID as covered in full, no deductible, no co-insurance, no out-of-pocket costs for employees. If you're fully insured, all the major carriers have agreed to waive all cost sharing. The one interesting note for many of you that have a high deductible health plan with a HSA account, the IRS has provided some guidance that says that the COVID expenses can be paid first dollar without having to meet your qualified high deductible health plan, and it doesn't violate the fact that your HSA then would be disqualified for first dollar payments of benefits. Next slide. Dr. Graham addressed this in his earlier comments, but telehealth is something that we've been really encouraging for several years now, but this is clearly the greatest opportunity to download the app that comes with your health plan and use the telemedicine services provided by your insurance carrier. All of those costs have been waived for typically would have had a copay, both for behavioral health and for medical services. This is not just COVID related. It could be any medical service needed is now eligible for a waiver of your copay. For those that are accessing telemedicine through your insurance plan, you do need to still download the app. Both PHP and Blue Cross use the Amwell app, but go to your insurance carrier's webpage and pull that information to download that app onto your phone. The other great thing, and Dr. Graham addressed this also, is that many of your primary care physicians and specialists have also ramped up their ability to do virtual care. So I highly encourage you to engage with your primary care physician and your specialists about being able to do your routine visits virtually. So the IRS has also provided some guidance along those lines, making sure that you're aware that you can access these telemedicine apps at no cost without violating your HSA contract. Next slide. So in regard to some of the benefits, easing up of some of the guidelines, pharmacy is one area where the insurance industry has relaxed their guidelines. You can now, in most cases, get extended medication fills beyond the 30-day supply that was typically the guideline. Your refills can be extended out 60 or 90 days. The maintenance meds, particularly through the mail order program, looking for a 90-day supply. Remember that if you're picking up prescriptions from the pharmacy, they're still applying your copay per 30-day supply. So if you pick up a 60-day supply, you'll have 2 copays for that prescription. Also, the local pharmacies and the online vendors are offering free delivery, something else to consider in this pandemic. Next slide. I think that's it. Great. Well, we can open it up for questions. Tim, did you have any comment?
No, thank you both. Very, very detailed and very good presentations. We will open it up for Q&A again. I would invite all of our participants who are on the call with us this morning to utilize the question icon at the bottom of your screen. Just a couple thoughts as you know, as we went through here, Greg, and I was intrigued by the HSA, you know, piece of this. And I think, you know, for us, a lot of our smaller businesses here have gone to the higher deductible plans. And could you just maybe expand a little bit upon that? Because if I heard you correctly, you would say that a lot of the co-pays and the maximum out-of-pockets are being waived now with the high deductible plans?
Yeah, for COVID-related treatment and for testing, the insurance industry has been given the green light by the IRS to be able to waive those expenses without violating the covenants within your HSA mandate, where you have to meet your deductible before anything can be covered. And so that's not all medical services. It's just COVID-related services can be paid for on a first dollar basis.
Fantastic. And then, you know, Dr. Graham, you talked a little bit about the, you know, the testing. And if I heard you correctly, you said, you know, for most people, testing is not necessary. we start thinking about from an employer standpoint, especially those essential employers, what process would they take? You know, if they've had somebody that's been diagnosed with coronavirus in their place of employment, I mean, what steps could they take, and how they go about getting people tested that might need to be tested?
Yeah, that's a great question. I'd go back to kind of first principle there, that their best initial point of contact is their primary care physician if they have one. Part of what they will be doing is managing this, is determining if testing is necessary, yes, no. If so, being able to help guide them to where that should happen, and ultimately you want them to be able to, the physician that is, to be able to get results. In some jurisdictions, I'm going to hedge this one a little bit because it depends on where you are. There's still, it's a little patchworky nationally. There are still some jurisdictions where county health departments are involved in this and need to be appraised of results or be doing contact tracing or of some sort. Again, the folks who are best equipped to do that, or the easiest to answer from most employers, is if you have a primary care physician, start with them. The second resource I would go to, at least in the mid-Michigan area, if you are still at sea about this, I'd point back to the Sparrow COVID page, which has pretty good walkthrough data about how to do that, how to approach that. Employers really shouldn't be put in the position of being public health officers. That's not what you need to do. It's really about, what do I need to do to accommodate a specific set of either restrictions or recommendations for what this particular associate needs to be doing for this period of time. It does vary in some ways from industry to industry, be very different answer in some ways for a healthcare worker, for example, than it would be for somebody in some other industries based on that. So kind of hard to give a simple answer for it, it varies from situation to situation, but hope those 2-3 resource points are helpful.
Sure, fantastic. So a few more questions coming in from the participants this morning. The first one says, when offices open back up, should I have automatic hand sanitizer dispensers at the entrance? What other supplies or practices should we have in place? Should break room, kitchen be closed? Any thoughts on that from any one of the three?
Well, I could take a swing at part of it. The hand sanitizers, frankly, some of what we're learning from this are things that we really probably should have been doing all along. I see Karen nodding sagaciously there. It's like, good grief, wash your hands. I kind of joked at the beginning of this. I've done my own private sub rosa survey of how often men wash their hands in restrooms. Dudes, you got to step it up on this one. So yes, please have hand sanitizer there. I think outside of that, specialized equipment, I wouldn't rush out to do that just yet. I'd wait and see. I have some faith that between the CDC, the federal effort, some of the state and local effort, there's going to be, once we get to the open things back up phase, there's going to be clear advice on what kinds of things do you need to have. And investing in a bunch of expensive equipment that you then subsequently don't need is not going to be helpful. It's also problematic to start consuming personal protective equipment that is still needed at the front line. And until we get that pipeline really sorted out, I wouldn't encourage people to rush out and do that. I think it's going to be more about physical distancing, quite honestly, than it's going to be about gear. So that would be my swag at it. I don't know if Karen or Greg, if you have any spit take on that.
I think one of the more frustrating things about this has been the simplicity of the answers in terms of distancing, controlling droplet spread of the illness. Unless the business has something to do with a procedure that aerosolizes someone's nose and airway secretions, there's just no reason to get carried away with expensive equipment. Hand sanitizer and masks to prevent the droplets from getting out of a person's nose or mouth onto countertops. You're going to be good after that. Unfortunately, it's been the simplicity of those things that make people shrug and not want to do them. So it's really worth doing. Wash your hands and keep 6 feet away and cover your sneezes. With a mask is certainly tough to miss when you're covering with a mask. It's there all the time.
Sure. Hey, Greg, maybe this question is probably maybe directed more for you. Can you expand on the EAP programs? Can a small business add those to their existing benefits?
Yeah, thanks, Tim. There are some freestanding EAP programs available in mid-Michigan, and some of our larger clients have engaged with those. But what I think most small business and their EAP plans are attached to is their long-term disability benefit. So if you have a group long-term disability benefit in your employer, many of those plans have an EAP plan built into them. So reach out to your agent and ask them for information about that EAP plan.
Fantastic. This is a question specifically for Dr. Kent. And how is Sparrow's PPE stockpile? Do you have adequate PPE to keep your staff protected? Is there anything the local community can do to help in this regard?
No, I have to say that I am completely blessed to live in this community and to be doing this job in this community. This has not been an easy time, but this community has just been fantastic. We got some heads up that our colleagues in Detroit did not get from a time perspective, and we utilized it great around here. Employers and the public have just done beautifully with social distancing, as well as heeding the warning. We closed up shop, we all went home, we did what we were supposed to do, and our modeling really does reflect that we've done better as a result. But as far as, and the PPE is the same way, we had at least a little heads up to start purchasing. We do purchasing, many more times what we need, and most of it does not materialize. We're using odd suppliers and things we're not used to, but we are right now okay for PPE. The masks that people are making are wonderful for the areas where we need to just protect from droplet spread. But in the areas where we need to protect from spread that's caused by procedures that aerosolize or put the virus into the air where it hangs there for a long time, that's when you really need those high-tech masks, which right now we have new ones to last quite a while, and we also are working with Michigan State to reassess those masks. So however long this goes on, we can protect our healthcare workers. Not only will we protect the healthcare workers, but their families. Healthcare workers are perfect vectors for this disease and can spread it in a community somewhat unwittingly, which of course you definitely want to avoid. So in that way, Michigan State and Sparrow have partnered to be able to provide safety for those healthcare workers for quite a number of weeks or months to come. The community's been fantastic, though, in the way that they've come in supporting the healthcare workers with the other masks, as well as just staying home and observing the social distancing. We have fewer sick people than we would have had. There's just no question.
Fantastic. Thank you so much. Dr. Graham, a question that came in specifically for you. Since COVID-19 is thought to have been in the U.S. since the December-January timeframe, are people who feel they had this going to be tested for antibodies and then be asked to give plasma as possible treatment for others?
Short answer, yes. I would not rush out to go to the blood bank to do that today. It is still sort of experimental phase, I guess, for lack of a better term. This is actually kind of a what's old is new again type treatment. It's convalescent plasma is a kind of old-timey way to do things. It was used actually quite a bit back during the 1918 flu pandemic. There are some issues with it as well, and there are some small-ish clinical trials going on right now to determine its safety and efficacy. You always want to know before you offer treatment to people, is it going to work and is it safe? Anytime you're using blood products, there are risks. So I would stay tuned on that one. It's a really great question, and I think to go back to Karen's point, it shows the civic mindedness of the people in mid-Michigan, which never ceases to amaze me. And part of the reason I live here, that people really want to do that. That call may come, and I think that it's worth paying attention to that. I think the other side of that is, we're probably going to be looking at vaccine trials for the not too distant future, which is another way people can potentially be engaged in this. So good question.
Well, we certainly are blessed to live in the amazing community that we do here as well.
Yeah.
I know that Greg, mentioned this as he opened up the presentation as well, that our insurance industry here in our region obviously is very significant to our economic success as a region. And I think to see what the insurance carriers have done in stepping up and supporting small business and the business community here as well should be really recognized. And so I know that on behalf of the business community and all of our members and the folks on the call today, we thank you for continuing to work with the businesses here as how they continue to address this crisis as well with all of their people, as well. So, maybe in the few minutes we have left, we'll round robin it here for just some closing thoughts and just some things on how you might leave the folks here this morning with how they continue to get through whatever we look at this new normal being. And, we're 3 weeks into this, and we know that at a minimum there's 3 more weeks, but certainly we know it's probably going to be much longer than that to get the economy back up and running. And I'm just going to start maybe counterclockwise, and I'll start in the upper left there with Greg.
Thanks, Tim. I appreciate the opportunity to share some information with the chamber and the chamber membership. And I encourage all of you to reach out to your insurance agent for support. We're all working from home. My entire staff is working from home throughout this COVID crisis, and we're one of those advisors that you can lean on for information to help your employees.
Dr. Kent?
I would just thank the community again for all of the really hard work in social distancing. I do want to emphasize something that was said about employee assistance plans. The fallout from this is everything. It's financial, it's spiritual, it's behavioral, it's health. So it is a big deal to get the support that you need adjusting to the new normal. There isn't going to be a cliff that we just fall off of and this goes away. We are going to learn to live with COVID among us, right? Just like we learned to live with the threat of terrorism after 9/11, just like we've learned to live with AIDS after that broke. This is a much bigger infectious disease than any of us have ever dealt with in our lifetime, but we will accommodate to living in the new normal where, we may start to bow in deference instead of shake hands. Who knows? The world will not be the same on the other side of this, but we have a lot of resilience. The earlier we get to work at that resilience, the better off we're all going to be. But this is not just going to disappear.
Dr. Graham, would you like to wrap this up this morning?
Yeah, I really appreciate the opportunity to be here, and remiss in not saying that. Thanks for putting this together, Tim and Ashley. This is a great discussion. I would join Karen in 2 things, and I think for the community, keeping eye on the ball. I know this is not a knock on the media, but I know if you're watching the news or spending your days flipping through social media, it looks like all is lost. It's a bad stretch, but what I'm seeing is an awful lot of good. And I am seeing, especially in this community, I think Karen is spot on. I saw my own healthcare system and my own health plan that I work with step up, do the right thing, even though it was painful, but do it early and do it for all the right reasons. I think to the rest of the community, particularly the employers who are on this call, you guys are all doing your part, and it's actually working. I know it's hard to see that sometimes, but it really is making a difference. I think it's part of the reason Mid-Michigan is doing knocking wood here as well as it has to date. And don't take your foot off the gas on this one. I think that's important. I think Karen's other point is an important one, that normal is not going to look like it was before. That's not necessarily a bad thing. And I think we have an opportunity, especially in the health plan industry. I think this has been a short, sharp shock. This really forced us to take a look at a lot of what we do and why. And is this really what's best for our members who are when they need us, they really need us. So I think as we get to the whatever the calmer waters are on the far side of this, don't miss the opportunity to really look at what does this look like? Is this the way it should have been? What could we have done better? And not be afraid of making some of those decisions, and do the best thing for our friends and neighbors and people who count on us.
Well, thank you for joining us this morning. Thank you to all the participants for joining us here, as well as Greg, Dr. Graham, and Dr. Kent for joining us too. Big thank you to our first responders, especially our healthcare professionals who are doing everything they can to protect all of us, but also to those folks that are battling, through some of the challenges as well with the coronavirus too. So this concludes the program this morning. We will follow up with other folks around here. We'll have the slides from both Dr. Graham and Greg's presentation this morning. We'll make sure we get those shared with you later today. Certainly encourage everyone to go out and make it a great day today. Thank you.
Thanks, everybody.
Thanks.